So good evening, good afternoon, everybody, wherever you are working. Today we have a webinar on hosted by World Federation of Public Health Associations, and the topics of the webinars for today is New Zealand's U-turn on progressive tobacco control policies. What lessons should other countries learn? So today we have Professor Chris Bullen, who is a public health specialist at the University of Auckland, and Ronan Payinda, who is a public health advocate, and he is currently the NCD Working Group member of World Federation of Public Health Associations. Next, please. So starting with the moderator, Ronan will moderate this webinar, and regarding his brief bio, he is the public health advocate and medical student at the University of Auckland. He is a UNICEF Young Ambassador, board member at NFACT. He is selected as a YSP Impact Fellow by AstraZeneca and One Young World for contribution to public health. He has developed a digital rehabilitation platform to enhance surgical outcomes and promote healthy lifestyles. And his research involvement is in AI and public health working group with the World Federation of Public Health Associations and JMIR Infodemiology. So without much delay, I would like to hand over the floor to Ronan for further moderation.
Hello, everyone. Kia ora koutou. I hope everyone's doing amazing right now. Thank you to Dr. Prajwal for that lovely introduction. I want to take a moment to personally acknowledge Dr. Prajwal's commitment to strengthening our global health networks. He's the chair of the Non-Communicable Disease Working Group here at the World Federation of Public Health Associations, and this talk would not have been possible without him. I know some of us are joining at very early and very late times, so I'm grateful to have you here today. And we will also be screen recording this webinar to share with our colleagues and other audiences in time zones that make it difficult to attend. I'm thrilled today to introduce Professor Chris Bullen. I met Chris 2 years ago when I joined his research project investigating the spread of tobacco and vaping outlets across Aotearoa, New Zealand. The project was funded by the New Zealand Ministry of Foreign Affairs and Trade, and they wanted us to take stock of how this industry had grown in New Zealand. And as I'm sure many people watching will relate to, regardless of what country you're in, you've probably seen similar data. Our results found a rapidly increasing number of tobacco and vape outlets across the country. And we also found that an exceedingly high proportion of these outlets were being established close to our schools, selling vape products to youth at rapidly rising rates. When I met Chris, he had been part of an amazing public health movement that had secured New Zealand with some of the most advanced tobacco control measures in the world. The government had launched the groundbreaking Smoke-Free 2025 action plan, and there was legislation put into place to ensure that this action plan was achieved. There were 3 main steps to greatly reduce the number of retail outlets selling smoking and tobacco products, to reduce the nicotine content of tobacco products to very low and non-addictive levels, and most amazingly, to introduce a smoke-free generation policy to protect young people from addiction to smoking. And these laws meant that smoking would effectively be phased out of New Zealand society, and young people would be unable to access tobacco products at any point later in their lives. But 2 years later, a change of government, and these laws were suddenly scrapped. Since then, Professor Chris Bullen has been one of the voices fighting back. Chris is an absolute force in the tobacco control space. He has worked with universities, governments, and public health advocates across the world. Before public health, he served the community as a doctor in New Zealand and in Papua New Guinea. He is a professor in public health at the University of Auckland and the academic director of the National Institute for Health Innovation. Chris was also the immediate past president of the Society for Research on Nicotine and Tobacco. So I'm incredibly proud and incredibly glad to welcome Chris to present his expertise today and share some of the lessons from here in New Zealand that the whole world can learn from. So I'll now pass the presentation over to Chris, and immensely grateful to have you here, Chris.
Well, thank you very much, Ronan, for that introduction, and also to Dr. Prajwal, and kia ora koutou, ko Chris Bullen toko ingoa. I'm Chris Bullen, and I bring you warm welcomes from Aotearoa, New Zealand. You can see the little backdrop. I'm doing a bit of a promo for some of our lovely coastal scenery and native bush. It's just outside the city of Auckland, where I'm based, the same place where Ronan is at the moment, and we're just emerging from winter here, and we're enjoying the first signs of spring. And I'm sure you're probably, many of you coming in from the other parts of the world, it's the opposite. But anyway, it's great that we can be part of a global network of people with shared values and objectives for public health. And it's been my privilege, as Ronan's pointed out in the little bio sketch there, to have worked in a range of countries and to continue to work to serve communities, particularly communities who are poorly resourced and marginalized in various ways. And one of the ways that happens is through the scourge of tobacco in our planet. It's a major force to be reckoned with, and I'm just one of many, many people who've been working very, very hard for decades to try and reduce smoking and other forms of tobacco use here in Aotearoa, New Zealand, and in other parts of the world. So what I'm going to share tonight is really not all my own work by any stretch of imagination, but it's very much a community led and academic contributed combined effort, and with people at every level of society working together to try and do something about this problem. Anyway, so I'm just going to share my screen and we will kick off. And the aim here is to, I will talk for around about 40 minutes, hopefully no more, and then we'll have plenty of time for interaction and discussion. Again, it's a real privilege to be able to join you as part of this webinar, and I hope I'm able to shed some light on our situation in New Zealand that will be informative for you in your country, because I think we have reached some heights, but more recently we've reached some lows, and we've learned a few lessons along the way from sort of the bruising encounter we've had with rapid policy shifts. So I'm trying to draw some good out of this situation. So the questions I really want to answer in this time together is, first of all, how did New Zealand pass a law designed to eliminate tobacco smoking? And then why was this law scrapped? And what are the lessons and implications for other countries? New Zealand's got a long and quite distinguished record with tobacco control. And as I hinted earlier, it began many years ago. I mean, this figure just shows trends in tobacco smoking in New Zealand from the early 1980s, when our government at the time launched its first formal tobacco control program. Just think about that. This is 1980s, is actually decades after evidence of the harms of tobacco smoking were available from some very important studies conducted in the UK and Surgeon General's report in the US. So unfortunately, having evidence of the harms of various products is no guarantee that governments will take action, and it often takes decades before any movement occurs. So that was the case in New Zealand. But then a number of actions happened to slowly tackle the problem of smoking, and we can see along the lines we had text-based warning messages on tobacco packets. Smoke-Free Environments Act was passed in 1990, and that was a major piece of comprehensive tobacco control legislation that drew on the best available evidence of the time, one of which was around the role of price in terms of reducing initiation into smoking and also motivating existing smokers to quit. And we've had dramatic increases in price over the decades, and that's probably been the single most important part of our tobacco control success to date. As we go along into the 2000s, you'll see a red line And that's when we first started collecting data on young people, teenagers, 14, 15-year-olds. And you can see the spectacular decline that's occurred in the decades since then, with youth smoking dropping now to very, very low levels, well below 5% generally. We've had reductions in smoking spaces where smoking can be permitted, graphic warning labels. We followed the Australians with that, and standardized packaging, smoke-free vehicles more recently, and lots of media campaigns, quit smoking support through quit lines. So a lot of support for people to help support their quitting attempts. So a lot of different activities aimed at different levels, denormalizing smoking in our country. But the job wasn't finished, and so there was more work to be done to achieve this goal, Awahi Kore, tobacco free or smoke-free 2025, established by a Maori Select Committee recommendations in 2010, which was really an exercise in calling the tobacco industry to account for the harm that they've caused, particularly Indigenous Maori New Zealanders. Tobacco smoking continues to reap a dividend of harm among Maori, and it's still, as we'll see in some of the figures I show later in my talk, still a significant problem and contributes to about 2 years of the current 7-year life expectancy difference between Maori and non-Maori New Zealanders. So if we got rid of smoking in Maori, we would see that gap drop significantly just through that one risk factor alone. The thing about this commitment to New Zealand becoming a smoke-free nation, i.e. a smoking prevalence for all New Zealanders by the year 2025 that was less than 5%, is that it was about following this Maori saying here, haere whakamua, hoki whakamuri, I walk backwards into the future with my eyes fixed on the past. So we learn the lessons and we move into the future, building on the shoulders of giants, learning the lessons from things that haven't worked or have worked well, and so we move into the future with that in mind. And I think it's a useful proverb to keep in front of us as we continue to struggle with this enormous problem and many other health risks and challenges for our communities. So we've got a countdown on the website, and this is a little bit out of date because I updated it last week, but nevertheless, we're looking down at a very short period of time between now and the 2025 deadline. And the big question for those of us who work in tobacco control and have been concerned about seeing smoking decline in our country has been, will we make smoke-free 2025? Well, our hopes were lifted when a Minister of Health took up tobacco control as her cause célèbre in the 2020s. This is Dr. Aisha Virel, who's an infectious diseases physician, has a PhD in epidemiology of tuberculosis, which she did in Indonesia. So she understands all about infectious disease, but she also understands about non-communicable diseases. And of course, tobacco plays a part in both. It's actually a risk factor for tuberculosis. But she took up tobacco control as an Associate Minister of Health and drove the development of the Smoke-Free Aotearoa 2025 action plan, because up until 2021, we had a goal, but we didn't have a plan. And so this is the plan, and I will just show what the elements of that were. So there are 6 elements to it, or focus areas, to achieve the goal. And the first one was to ensure Maori leadership and decision-making at all levels, for the most affected populations to take up the lead, because they've demonstrated a long history of amazing leadership and inspirational leadership over many, many decades, and to continue that and be resourced to do that. The second was to increase health promotion and community mobilization, because we know that smoking is concentrated now in areas of greatest deprivation, and often where stores, retail, density, selling tobacco, products is most concentrated. We need communities to stand up and have some say in the way these products are marketed and sold in their communities. Third was to increase evidence-based stop smoking services. And we've already got pretty good, by world standards, stop smoking services, but they need to be a little bit more innovative and more accessible and widespread. Now, the next three strategies really are where the rubber meets the road, because legislation needed to be put in place to make some of the changes that I'll show you, and Ronan's already mentioned them. The first is reducing the addictiveness of smoked tobacco products, and primarily that is through taking the nicotine out of all tobacco products. So New Zealand was going to lead the world in denicotinizing its tobacco supply. And we'll talk about the evidence behind that in a moment. The second is about reducing the availability of smoked tobacco products. And the way the government planned to do that was to dramatically reduce the number of retail outlets selling tobacco around the country, from around about 6,000 to probably down to about somewhere between, it's been suggested, 80 to 600. So a marked reduction, whatever way you look at it. And then the third strategy was this one that's referred to as the smoke-free generation policy. And the way New Zealand looked at doing this was to make it illegal to sell tobacco products to anyone born after the 1st of January 2009. In other words, the law would be broken if you tried to sell tobacco products. It wouldn't be from trying to buy the tobacco products. The onus is on the retailer to comply with the legislation. That's an important distinction because the so-called prohibition is not really a prohibition. It's just the government doing what it should do, which is to protect the public from incredibly harmful products that kill 50% of the people who use them long term, which seems to me to be what good government should be all about, protecting and ensuring the long and healthy lives and flourishing of its people, especially giving young people the opportunity not to become addicted to an incredibly harmful product. Nevertheless, so this was a sort of distillation of some of the key objectives within that action plan, and I'll just read it out. Our vision is to eliminate the harm smoked tobacco products cause our communities by transforming Aotearoa New Zealand to a smoke-free nation by 2025. And the goal was by 2025, daily smoking prevalence is less than 5%. And I've bolded and underlined the word all for all population groups in New Zealand. And sometimes this distinction between all population groups and the population overall is forgotten about. And I think if we reach 5% overall prevalence, that's great, but it's not good enough, because we will be leaving some people behind. And some of those people are from population groups who've been the most adversely affected for many generations by the harms of tobacco smoking. So I'm speaking about Indigenous Māori. I'm talking about some of our Pacific Island communities who have been in New Zealand for many years, or more recent migrants, as well as people who have drug and alcohol and mental health issues, and where smoking prevalence is incredibly high. And so if we don't bring everybody with us, then I think we would have failed. And so that's one of the challenges with the national goal. Well, you may ask, these are exciting and pretty bold objectives, but what did the public think about this? And particularly, what about people who smoke still or have just recently quit? What did they think? We have some really great research being done here in New Zealand. And one of my colleagues, Richard Edwards from the University of Otago, has led what's called the ITC study. This is the International Tobacco Control Study, the New Zealand version of that. And it's been run in many countries around the world. And we've had the opportunity to run some waves of these surveys in New Zealand. And they asked people who were smokers about what they thought about these likely strategies for reducing smoking in New Zealand. And you can see that The participants, people who smoked were the orange bar, people who've recently quit in the grey bar, and all participants in the blue bar. And you can see as we go along, there was very high levels of support for greater investment in media campaigns to reduce young people from smoking. So people who smoke generally regret ever having started smoking. And I think this slide demonstrates that very clearly. Over 90% of current smokers said, don't whatever you do, let young people start smoking, spend more money on media campaigns to stop that happening. And even with the smoke-free generation law, very high levels of support, in the high 70s. And for people who've recently quit, just over 80%. What about the law to reduce nicotine in cigarettes? The very low levels, very high levels of support, 70, 75%, for ex-quitters, over 80%. What about reducing the number of retailers or licensing them to restrict the sale of tobacco? Again, remarkably high, considering this would be an inconvenience if you were a smoker. Quitting media campaigns, well supported again. The least popular one was that dramatic reduction, 6,000 to 300, and that was an indication, I guess, of some inconvenience. But you can see that the recent quitters thought that's not a bad idea, because for them, I guess, they don't want to be tempted by having the product that they were perhaps addicted to for many years being so conveniently located. But with all this going on, what were the predictions that we would actually get to that goal, not just for all New Zealanders, but for Maori in particular, who have had a very high smoking prevalence and suffered a huge amount of health loss, premature mortality and morbidity as a result of tobacco smoking. So you can see in this figure, this is based on some modelling of smoking prevalence reduction under sort of business as usual assumptions if we didn't do anything for a start. The dotted line is for non-Maori New Zealanders, who are the majority of the population, about 70%. And you can see that smoking prevalence in 2011, about 15%, dropping, maybe just nudging that 5 to 6% line. But for Maori, a faster decline at this point in the curve predicted, but still at about 20%, which is certainly not an equitable situation. So this tells us a story that with business as usual tobacco control, mass media, plain packaging, et cetera, we just weren't going to make it. And so we needed something a bit more dramatic, hence the action plan and hence the legislation to support the action plan. So the Smoke-Free Environments and Regulated Products Act, which was an amendment to the Smoke-Free Environments Act, known as the SERPA, just the acronym, was the new key piece of legislation that Dr. Verrill pushed through with support just before Christmas in 2022. And it's probably one of the most comprehensive pieces of tobacco control legislation in the world. It had a number of aims, but which you can see includes both tobacco and vaping products. It's about restricting sale and supply, regulating, controlling marketing, advertising, promotion, discouraging young people, particularly non-smokers, from taking up vaping, regulating products, smokers, tobacco products, monitoring and regulating presence of harmful constituents, which could include nicotine. So this gave rise to the Amendment Act in January 2023. It came into force. And so the rules of the game changed. So from July 2024, the number of retailers able to sell tobacco products was going to dramatically be reduced. April 1, 2025, the amount of nicotine was going to be reduced dramatically to non-addictive levels. And from January 2027, prohibit the sale to anyone born after 1 January. That's the smoke-free generation policy. So you needed law changes to enable these actions in the action plan to be enabled. And they all take time to get these processes in place to license retailers, to have negotiate contracts with suppliers of low nicotine tobacco and to replace them, the normal tobacco in the stores, to set up processes for monitoring and enforcement and auditing of the amount of nicotine in tobacco and so on and so forth. So a lot of work to get, and that's why it's sort of staggered introduction and is a year or two out beyond the law coming into play and the timing of the introduction. So there's a lot going on there, and in the interest of time, I'm just going to focus in on this idea of reducing the nicotine in tobacco, which was actually likely to be the single most effective and pro-equity strategy of the three in the short term. And so if you're wanting to get to smoke-free 2025 for all population groups, we believed in the tobacco control community that this would be the most dramatically effective. With 95% less nicotine in these cigarettes than current cigarettes, they become non-addictive. There's good evidence, as I'll show later on, that there's from randomized controlled trials, which we've done in New Zealand and colleagues in the US and other places. But it's never actually been tried in the real world in a real environment. And so there's a lot of international interest in this policy. Okay, so the question is, would this work? Was it sort of somewhat experimental? Well, we believe if you look at this model here, business as usual for Maori females in orange, black Maori males, the non-Maori females in the green, blue non-Maori male, and then the overall population is in that sort of lighter orange color down there, but about 15% in 2020. And you can see with the dotted line is the denicotinization intervention. This is all modeled based on assumptions that draw on evidence from randomized controlled trials and other related studies. And this suggests that you would see dramatic declines in smoking prevalence for all population groups. We wouldn't necessarily make it to 2025 by Maori men and women, but within a few years of 2025. And it's probably the most likely to achieve the objective overall. And if you put the three strategies, denicotinization, smoke-free generation, and retailer reduction together, we believe you actually achieve that goal. And you can see on the graph the Maori men and women line just sneaking in around about 2025. But as I said, denicotinization would achieve most of the health gains. So you get a longer term benefit from the smoke-free generation because it locks in the elimination of tobacco from our country forever from the point of time. And so it creates a whole generational movement of young people who don't have any kind of rite of passage of trying out smoking when they turn 18 or 21 or something. It's just that you're never allowed to be sold it because it's a defective product that is incredibly harmful. Just like lead-based paints or asbestos shouldn't be sold anymore in any country. So that combined package, compared with business as usual, could reduce the gap between Maori and non-Maori all-cause mortality for people aged 45 years and over by up to 23% for females and 10% for males by 2040. So that's a lot of health gain. And in countries like ours, where the cost of healthcare is rising daily and government has less money to afford good services, what a wonderful investment in prevention. This seemed to represent, it seems like a no-brainer, as they say. However, we had a change of government just after the Act was passed and starting to bed down. The regulations were started to be developed, and this new government was a coalition government which had a major party which has historically supported our progressive tobacco control legislation. And in fact, in the select committee hearings leading up to the passage of our SERPA legislation, that the party members were broadly supportive of those three strategies. However, in order to get into government, they had to form a coalition with two minority parties. And in the coalition agreement, one of those parties specified that they would only come into coalition if the Act was repealed. And that is what happened. The new government said in the first 100 days of power, we're going to repeal that act. And when we heard the news, colleagues and my colleagues and I who've been working in this space were almost speechless. We couldn't believe that the government was entertaining this. It's a complete U-turn on the direction of travel for tobacco control in New Zealand. And what we asked could possibly justify that. Well, that's the question. What justification did the new government have for repealing this act? All the regulatory work for denicotinization, retailer reduction, smoke-free generation, completely off the table. The new Associate Minister of Health, Minister Costello, who took on responsibility for tobacco control from Dr. Verrill, said, the last government was moving towards an unfair regime with a focus on prohibition that ignored how quit smoking initiatives were working, and the potential downside of what she called a prohibitionist approach for smokers, and also the impact on retailers and crime was being ignored, or at very least trivialized. So those were her words in Parliament in terms of justifying it. So here are the arguments really that have been mounted over the last year from the government and various fora about repealing the act. First of all, they said the evidence underpinning our strategy wasn't based on, wasn't there. There was no basis in evidence. Secondly, that the strategy was a kind of prohibition. Thirdly, it would increase black market and create targets for crime against retailers of tobacco. Fourthly, that the smoking rates were already declining rapidly. We didn't need these additional strategies because things were moving towards achieving the goal anyway. And then perhaps most chillingly concerning to me was the fifth justification, which was that allowing tobacco to continue to be sold in its present form would enable the government to be able to afford tax cuts for middle-class New Zealanders, which were promised in their election campaign. So let's just take each of those justifications and look at them with a closer microscope. The first was that denicotinization was not based on evidence. Well, in 2012, we did this trial, group of colleagues and I who've been active in the clinical trials for smoking cessation space for almost 2 decades. This was a combined effect of very low nicotine cigarettes used as an adjunct to usual quitline care, nicotine replacement therapy, and behavioral support and smoking cessation, a randomized controlled trial. We randomized a total of over 1,400 people who were smokers to to use these denicotinized cigarettes and or quitline care, which is free nicotine replacement therapy and behavioral support. And we found that addition of low nicotine cigarettes to standard quitline care helped some smokers to become ex-smokers. So about a 50 to 20% increase in quit smoking rates with the use of these cigarettes. So people lose interest in smoking once the nicotine's gone out of them, and very quickly cut down and look at moving out of smoking these products. They don't enjoy them particularly. This was a very large randomized controlled trial of reduced nicotine cigarettes conducted by colleagues of ours in the US, published in the New England Journal of Medicine, and it showed exactly the same findings. This was 840 people, 780 of whom completed the study, very well conducted study, and one of the things they monitored was compensatory smoking, which is a concern that's been raised by people. So people suggest that if you take the nicotine out of cigarettes, people will puff more frequently and more deeply to try and extract the little nicotine and sort of titrate their nicotine that they get out of cigarettes. But this showed that in people with serious mental illness who are often heavily dependent on cigarettes, that compensatory smoking, as judged by puff duration, puff volume into puff duration, etc., that just didn't happen. And repeatedly, all the studies show that there's often a brief period of increased puffing, but people soon realize they can't get enough nicotine out of these cigarettes. There's such low levels. And so they rapidly move on to nicotine replacement therapy and and it increases their quitting rates. Secondly, there was the question of prohibition. And this new government in New Zealand doesn't like prohibition. It smacks of what they call nanny state or state interference over individual choice. But of course, things are a little different with tobacco. It's an incredibly addictive product. And when addiction's put into the mix, we're taking away people's choice, especially if people started smoking at the age of 15. I was just looking at data this afternoon from a large randomized controlled trial we've just wrapped up. And the average age of the people who took part in that trial was 15, and they were now, at the start of smoking, they're now 45, so 30 years of continuous smoking. And this is an average group of New Zealand people who smoke. Does the government have the right to sort of prohibit it, as the smoke-free generation policy could be framed? But as I've made that point, a good government acting responsibly has to take some action on harmful products and remove them from the market ultimately. Other governments, including the UK, which had a very right-wing neoliberal government, actually supported this measure, and still we understand plans to introduce it. It does address an important concern with age restrictions, because when there are age restrictions in place, as some jurisdictions, states and municipalities have with tobacco, it does lead to the message that maybe when I'm turn 18, I can go out and buy my first cigarettes. Whereas the smoke-free generation policy just takes it away. They're not even on the radar at all. And it's also the bottom point there on the slide. This respects the high levels of public support for this policy that we were able to evaluate and report on. And so when governments repeal things of this sort, it really is a smack in the face for evidence and for public support. Well, the next argument was that reducing the number of retailers and reducing nicotine and tobacco would lead to a rise in the sale of illicit tobacco and potentially foster increasing criminal activities. Well, we wrote this paper called False Zombie Arguments About Illicit Tobacco Shouldn't Be Given Any More Oxygen. And the idea of zombie arguments is that they keep rising from the dead despite evidence that they should be dead and buried, and they keep digging their way out of the grave, and we hear them time and time again. And so we just noted in this paper that the government of the day was using these arguments that have been shown to be patently wrong. And in fact, I'm leading a piece of work monitoring the illicit trade in tobacco in New Zealand for the Ministry of Health at the moment. And over the last few years, well, we've looked back since 2012, there's been on average quite a steady decline in illicit trade in New Zealand as the number of smokers has declined. You might expect if there was a fixed proportion of people accessing either homegrown or smuggled tobacco, why would that necessarily change, all other things being relatively equal? If the policy is tightened up, yes, there might be a little flurry of activity, but we've seen as prices gone up and up and up of tobacco, illegal tobacco sales have actually continued to decline. So we don't believe the arguments of the tobacco industry or of the government of the day that this is necessarily a concern. It needs to be monitored, but we don't believe the evidence supports their claims of a rise in crime directly related to tightening the screws on tobacco availability or denicotized tobacco. The other argument is that, well, smoking prevalence is reducing anyway, and this is current and daily smoking, current in the green, daily smoking in blue, and reducing anyway, and it is spectacular declines for all New Zealanders. And you can see this for 18 to 24-year-olds, similar, really going quite low for daily smoking, down to below 5%. So they've already reached the 2025 target. But let's have a look by ethnic group. And looking for Maori, yes, fantastic to see the declines, and apparently spectacularly for Pacific people, although the number of Pacific people who took part in this study was relatively small, so the estimates are a bit stable. We'll have to wait to see next year's data to be absolutely confident in it. Asian New Zealanders have already reached and gone below 5%. but for Maori New Zealanders, 17.1% still. So we don't have an equitable situation here by any means. And if we're going to leave no one behind, we will have failed miserably if we don't do something more dramatic. And then the final justification was that our Minister of Finance, Nicola Willis, admitted that scrapping the smoke-free laws will actually be done in part to help fund tax cuts. And this was an interview that was done, I watched it on television live, where she said this and made this statement. And we think, she said, I think that's a more realistic solution than what the previous government was headed towards, and raised all these arguments. And I was just gobsmacked that anybody could be so patently and chillingly able to make those sort of statements. So we found out subsequently that our Minister of Health has been working hard against the best advice given to her by health officials, and she actually has breached our founding document of New Zealand, the Treaty of Waitangi, which establishes the rights of Māori to have sovereignty over their own health and to be protected by the government of the day from harm. And so there are some cases being brought against her and the government. And even she said, look, the government's committed to reducing smoking, but they wanted to take a different regulatory approach to discourage smoking and to reduce the harm it caused. And that sounds a lot like the tobacco industry. And in fact, some colleagues of mine have done an analysis of the language that's been used by the tobacco industry and how that's fed into ministerial papers. And it's rather frightening to see the parallels between what some of our government ministers are saying to justify the repeal and to promote new approaches to tobacco control, and what was originally said by the tobacco industry in various documents. Yeah, Minister Costello claims she's no prior links with the tobacco industry and is committed to the smoke-free target, but there are chilling similarities between the language, and I've got some up on the screen. Well, there was actually a lot of protest about the government's U-turn on tobacco control. And here is an image of many of the people who got out in the streets and voiced their concerns. We had a large march across the road from our largest hospital and our medical school, with many of our staff from both the clinical staff and the researchers and academics joining together with members of the public with placards and marching down to one of the government members' electoral offices. And this happened all across the country. But despite the complaints and despite the media advocacy and about the evidence that this would cost lives and there would be blood on the hands of the government, they didn't budge. And then just a week or two ago, we heard that the minister has ordered a 50% cut in excise tax on the tobacco and heated tobacco products, which are a sort of vape-like product that actually uses tobacco. And these are made by the tobacco industry and marketed quite aggressively online. So this was just another, I guess, slap in the face for those of us who've been working in tobacco control. And as a colleague, Janet Hook, a professor of public health at the University of Otago, said, the move seemed weighted in favour of the tobacco industry rather than in favour of tobacco control. So we've had a hard time in New Zealand with our recent history of tobacco, and the tobacco control community here was really quite unprepared for this U-turn. So it took us quite a while to get over the shock and the disbelief. And I guess what we've learned is that political expediency trumps evidence, long-term commitments, principles about equity, and public support. And so, you know, our trust in politicians to do the right thing has certainly gone down a lot. Really, tobacco control is an ideological battleground, and the arguments that are used by the government of the day to justify the repeal are really grounded in a very strong ideological position about the role of the state and individual agency. And you can see the influence of the tobacco industry, which continues to be strong. So perhaps we fooled ourselves into thinking that the tobacco industry was just lying down and letting these bold new tobacco control strategies be rolled out in New Zealand. But I think they could see that if New Zealand led the way, other countries would follow. Just as Australia, when it did its tobacco plain packaging, was taken to court by the tobacco industry, but won the court case. That emboldened New Zealand and many other countries since to go down the plain packaging route. We thought it would never happen, but it was done. And similarly, if New Zealand was able to lead the way, that would be a huge blow for the tobacco industry. And so I think quietly behind the scenes, they could see if they could work with the politicians and the other parties. We shouldn't underestimate what they are capable of doing in the interest of selling more of their harmful products. And of course, tobacco smoking is just as dangerous as it's ever been, and our eyes do not, should not move far from that particular concern. And we can't sit on our laurels, because there is the risk that smoking, even though it's been going down year after year in New Zealand, could make a comeback. What is cool and what is not cool changes very, very rapidly. And you can see some of these influencers out there in social media are having a huge impact on what young people think is a good thing to do or experiment with. And so this was from The Guardian just last week. Campaigners warn of complacency about the effects of habit picked up by celebrities featuring on fashion catwalks. And so we shouldn't underestimate the ability of the tobacco industry to place its products with influencers and in prominent places to try and re-normalize tobacco smoking. There are consequences for these U-turns in tobacco control policies. Obviously, good policies have good consequences for people's health, but bad policies have serious consequences. And we're not just talking about a game or a race like the Olympics. People's lives and futures are at stake. And the repeal of our legislation is inevitably going to lead to more premature deaths and disability than would have otherwise happened. We estimate about an avoidable 3,000 extra deaths as a result of this over the next few decades, with an unfair, unequitable, disproportionate burden falling on Indigenous Maori and other New Zealanders from already minoritised and marginalised populations who already carry an undue burden of health harm. It's a breach of our national founding document, the Treaty of Waitangi, by failing to engage with Māori on an issue that would lead to the loss of Māori lives. Our new government, I believe, has failed to meet its obligations under that treaty. And then by failing to listen to the voices of the majority of New Zealanders, including smokers, and the weight of evidence, the government's sending us a signal. It doesn't respect their views or scientific evidence, but it actually privileges tobacco industry claims. Well, we've got a lot of research going on in the background as part of our advocacy campaign to show the government that what it's planning to do is unlikely to be of great benefit to people. In fact, will likely to be harmful. And so there's a lot of work that's going on in the background to continue to provide evidence that feeds into the advocacy campaigns and trying to build up a case, because we need to be poised to pounce with evidence, with well-trained spokespeople and key messages to the public and our politicians to say, change your mind, think again, let's get back to where we were, because we need to drive this harm and put an end to tobacco smoking and tobacco industry influence in our country. So it requires sustained advocacy, picking yourself up off the floor, having thought you'd won the day, picking yourself back up off the floor, sucking it in, and getting together to form evidence-based policies that put people, their rights, and health equity ahead of tax revenue, but with a heightened awareness and increased scrutiny of tobacco industry influence, and perhaps a little less naivety, thinking that we'd won the day, but we hadn't. So New Zealand's tobacco control community has got a range of positions on elements of the Tobacco Action Plan and Act, but we all singly united around a focus on reducing smoking for all New Zealanders. That is our priority. And thank you very much for listening.
Kia ora, Chris. I just wanted to thank you for that fantastic presentation. I mean, being here in New Zealand, I knew a lot of the context, but there was just so much insight in there and such a detailed breakdown of how this process happened. So I just want to thank you so much for sharing that with us, sharing that knowledge. And I especially want to highlight something that Chris said when it comes to the international shared struggles that all of us have in global health and public health. Because Chris mentioned that probably one of the reasons the tobacco industry fought so hard against this policy in New Zealand is because they knew if it won here, other countries would start picking it up, that it would embolden public health advocates around the world to point to an example of a country where it's implemented and say to governments, we can do this and makes a difference to our populations. And so thank you so much for highlighting that, Chris. And I think all of us here today, no matter where on the globe we are, we all know that we're part of this shared struggle and this shared movement. So thank you so much for that, Chris.